We are turning to the latest on the fight against COVID. An FDA committee is set to talk about vaccine boosters for the general public on Friday. If approved, it would mean a third shot for anyone who received the Pfizer vaccine. Now, Moderna has also submitted data to the FDA for approval of booster doses, but there is still debate over the need for a third shot. Some experts say the focus needs to be on people who have yet to get their first dose. Joining me to talk more about all of this is Dr. Tom Balcezak, the Chief Clinical Officer at Yale New Haven Hospital. Doctor, thank you so much for taking some time with us today.
Of course, you're welcome.
So everyone's really talking about this. The big question, where do we stand on needing boosters? We're hearing we need them. We're hearing we don't need them. What's the latest?
Well, I would divide. I think you contextualize it exactly right, which is our first focus should be the people who have not yet been vaccinated. And here in the state of Connecticut, that still represents hundreds of thousands of people. That needs to be our primary focus. And of course, the WHO has recently put out a statement that internationally our focus should be on those countries who have yet to be vaccinated, even a small proportion of their population. But back here in the United States, we're very lucky to have so much vaccine availability. The position is now talking about third doses for people who are immunocompromised. And of course, we have wide availability of that in Connecticut. And as you point out, the FDA and the CDC are expected to put out rules later in the week around folks who don't have any immunocompromised status and whether or not they should be getting booster doses. And that's yet to be seen. And there's been some controversy, as you know.
Also here, we're talking about two vaccines, Pfizer and Moderna. Could there be a case where people who got vaccinated with Pfizer need a booster, but people who got Moderna don't? Or is this more likely to be some form of a blanket approval across the board?
Well, that's a lot of speculation, but I think if there's going to be a booster for one of the mRNA vaccines, there's very likely to be one for the second. Of course, the third approved vaccine in the United States, the J&J, there's been also talk that perhaps there might be a booster at some point for that, but I think that's a much further out time frame.
If these boosters are approved, doctor, is this a situation where if you got the Moderna vaccine, you are married to Moderna forever and should be getting the booster from Moderna, or can we mix and match?
That's again yet to be seen, and what we'll see what the FDA final ruling is, but there's some suggestion that they're going to allow a mix and match on this strategy.
And where do you think people are going to be able to get these booster shots? Is it a situation where we have these mass vaccine clinics again? Is it that maybe you're able to head to a pharmacy or potentially even your primary care physician?
I think it's going to be a mixture of all of the above. And I think there's going to be a little bit, if there is a booster approved for the general public, it'll probably be rolled out in age groups, the oldest folks going first. And there is much more availability of vaccine right now across Connecticut than there was in January, February, and March when the first doses came out. So there's going to be lots of opportunity for people to get it at their primary care offices in some cases, certainly at retail pharmacies. And health systems like ours will also be making third doses available when it's approved.
All right, still a lot more to learn, but some very good information there. Dr. Tom Balcezak, thank you so much for being with us. We appreciate it.
Thank you.
Coming up next right here at 4 o'clock, Amazon's on a